Your objective in this station is to physically demonstrate the assessment and management of a medical patient. You're being evaluated individual in the skill, but you have an imaginary partner who works under your direction. At the appropriate times, please describe to me those procedures you would delegate to your partner. You may assume you have any needed equipment. For each assessment section, I'll read you a brief patient scenario, and during the assessment, I will answer any questions you would normally ask your patient. Remember, this is a practical exam, and you must physically perform the assessment. Do not assume that I can see what you were doing. Briefly tell me what you were doing as you do it. You have 15 minutes to complete each assessment. You'll be stopped at 15 minutes and evaluated on your performance to that point. Please let me know when you're ready to start.
Ready, sir.
Okay. You respond to Walmart for a 50-year-old male with an unknown problem.
50-year-old male, unknown problem. Okay. Scene safety BSI.
Okay. Scene is safe. You find your patient sitting in the front part of Walmart by the cashiers. He looks a little uncomfortable.
Okay. He looks uncomfortable. So I've got one patient. He's appearing uncomfortable. We'll start to do our assessment for whether additional resources needed and activate our ALS. General impression, you said that he's kind of sitting, looks in general distress.
He looks a little pale, and he's breathing a little fast.
Okay, a little pale, breathing a little fast. So at this time, I'm going to approach my patient, introduce myself. How you doing, sir? My name is Joe with ABC Ambulance. You okay if I try to help you out today?
Yes. He tells you he's having a hard time breathing, and he has a funny feeling in his chest.
Hard time breathing, funny feeling in his chest. Okay. As I do my airway assessment, do I notice any cyanosis or angioedema, anything in the airway?
No, airway appears clear. He's speaking in fairly full sentences.
Okay, so airways, patient's able to keep their airway open, is patent, and they're able to secure their airway at this time, so I want to move on to my breathing assessment. The patient did complain of some shortness of breath. As I do my visual inspection of chest rise, do I notice what is the respiratory rate of my patient with chest rise and fall, and do I notice any accessory muscle use?
There's no accessory muscle use. He's breathing about 28 times a minute, and it's shallow.
Okay, so at this time what I'd like to do is listen to lung sounds. So, sir, if you're okay, if you don't mind just sitting forward, I'm going to come in, and with my stethoscope, I'm going to be listening. Can you take a deep breath in for me? Over an inspiratory and expiratory phase, I have 6 fields, and the posterior. Listening to my lung sounds. How do my lungs sound?
He has slight rales at the bases, otherwise he's clear.
Okay, so some rales and bases, otherwise clear. All right, based on the shortness of breath, a little bit of lung sounds of rails and the bases, I'm going to direct my partner to put my patient on high flow oxygen, 15 liters per minute. We're going to deliver this oxygen therapy through a non-rebreather mask. Does my patient accept this intervention?
He does.
Okay. So I'm going to move on to my circulation. I'm going to feel for my radial pulse. How does that feel?
Patient has a pulse. It's rapid and a little weak.
Rapid and weak. And how are his skin vitals?
Skin is pale, cool, and dry.
Okay. And no obvious signs of bleeding.
No trauma at all.
So based on the patient's presentation that they're complaining of shortness of breath and some chest discomfort, we've got them on some oxygen therapy. We're going to say this patient's a high priority patient. We're going to minimize our scene time and do a quick assessment and start our transport to the hospital. So at this time, I want to start to ask my patient. So sir, you said that this chest discomfort and shortness of breath. What were you doing when this started?
I was over in the gut section of Walmart.
Okay. And when you have this kind of chest discomfort, shortness of breath, has anything made it better or worse for you?
Nothing's made it better. Walking around seems to make it worse.
Okay. All right. So kind of some physical activity seems to make it worse for you. Okay. And when we look at this here, can you describe the discomfort in your chest for me?
It feels like someone's got a big weight on my chest.
Okay. So kind of like a pressure?
Yes.
Okay. And on a scale of 1 to 10, 1 being no pressure, 10 being the worst pressure, you feel kind of like you're being crushed or squeezed. Where do you fall on that scale?
It's about a 7.
About a 7. Okay. And when we look at how long has this been going on?
About 35 minutes.
About 35 minutes. Okay. You got some shortness of breath. You have some chest discomfort. Is there anything else that's bothering you today, sir? Any headaches, nausea, anything like that?
A little bit of nausea.
A little bit of nausea as well. Okay. And sir, are you allergic to anything?
It tells you he's allergic to penicillin and antibiotics.
Penicillin and antibiotics. Okay. All right. And in terms of medical history, do you have anything that you've been seen a doctor for?
Tells you he has a history of high blood pressure and high cholesterol.
High blood pressure and high cholesterol, okay. And so you see a doctor for these conditions. Has he prescribed you any medications that you take?
Yeah, I take a Tenolol, and I also have some nitro that he gave me for episodes like this.
Okay, so you take the atenolol daily for your high blood pressure, and the nitroglycerin you take kind of as needed?
Yes.
Okay. Have you taken that nitroglycerin today, sir?
No.
No? Do you have that with you?
I do.
You do. You have that with you. Would it be okay for me to take a look at that nitroglycerin, sir?
Sure. He
Okay.
hands you the nitro.
Okay, so as I'm doing this, I'm going to direct my partner to start getting me a baseline set of vitals.
Okay.
Sir, in terms of last oral intake, when was the last thing, or when was the last time you ate today?
He tells you he had lunch about 2 hours ago.
About 2 hours ago, and you said this started about 35 minutes?
Yes.
Okay. Have you ever felt like this before, sir?
I've had similar episodes in the past, but not this bad.
Okay, and when you had those similar episodes, did you see a physician? Did you go and see your doctor?
I took the nitro and it went away. I didn't take the nitro today because I wasn't sure it was the same thing.
Okay, so you haven't taken the nitro. All right. So as my partner is getting those baseline set of vitals, we would reassess that pulse. What is the pulse for my patient?
Heart rate is 120.
Okay, we got a heart rate of 120. He remains kind of cool, clammy, and cool, pale, and dry.
Yes.
This here now. What about a blood pressure?
He's got a blood pressure of 148 over 80.
148 over 80. Okay. Sir, have you ever taken aspirin?
I have taken aspirin.
You have taken aspirin, and you were okay taking the aspirin?
Yes.
No ill effects? Okay. And you haven't taken your nitro yet today. So as I examine the patient's nitro, I'm looking at, making sure it's within expiration. It is prescribed to the patient. And for both our aspirin and our nitro, we'll go over our 5 rates before administration. So what I want to do is I think this patient's having a cardiac event, so I want to go down that treatment. So, sir, what I'd like to do is, when you're having this chest discomfort, I'd like to try a couple medicines to see if we can get you feeling a little bit better. Are you okay with that?
Yes.
Okay. So the first medication that I want to give you is some aspirin. All right. So normally when you take aspirin, you swallow it down. Today what I'm going to do is I'm going to give you 4 little tabs, and I'm going to have you chew those up, hold it in your mouth as long as you can, and then swallow them down. So when we pull out our aspirin, we're going to check our 5 rights. So we're looking, we have the right patient. The right medication is going to be aspirin, and we're looking at 324 milligrams for 4 little baby aspirin. The route is going to be oral. We're going to have him chew it up and hold it in his mouth, and this is the right time because we think he's having a cardiac event. So I'm going to confirm again, sir, no allergies to aspirin owing to the antibiotics?
Yes.
Okay. So at this time, I'm going to give him the 4 baby aspirins. We're going to ask him to chew them up, hold them in his mouth, and then swallow them down. Is my patient able to comply?
He does.
Okay. So now that we have that on board, what I'd like to do is you've taken this nitro before, you have been able to administer this, and you've had relief before with this medication? Yes. Okay. So with this medication, I'm not sure if your doctor's kind of talked to you, so I got a couple questions I have to ask everybody before we kind of assist with this medication. So we've checked your blood pressure. Your blood pressure is okay for us to give you this medication because, as you know, this will probably kind of drop that blood pressure. So you might feel a little bit dizzy. It might, increase your nausea a little bit. These are completely normal. You might end up having a little headache. And when we administer this and it goes under your tongue, you may feel kind of a little burning, and that's all completely normal. So before we give you this, there is a medication a class of medications that's very dangerous if we mix these drugs. So I know it sounds a little bit silly, but in the last 72 hours, have you taken any medications similar to like a Viagra or Cialis for any different number of reasons the doctor might prescribe it for you?
No.
No? Okay. So at this time, we've confirmed our blood pressure is within range. We're going to check our 5 rates on our nitro. This is a medication that's standing order to assist. It is the patient's medication, so we'll make sure that this does belong to the patient. So again, we have the right patient, we have the right medication, nitroglycerin. We're going to go with a dose of 0.4 milligrams sublingual, so the route is under the tongue. At this time, we believe it's a cardiac event, so it's the right time to give the medication. We've explained the common side effects to the patient. So at this time, we're going to administer this, and this goes under your tongue, sir. So we'll remove the oxygen mask, have them place it on the tongue. And at this time, we want to start to package our patient to get ready to transport to the hospital. So we'll get them in the back of the ambulance, and then I want to reassess, the condition of my patient. Respiratory rate, lung sounds. I definitely want to get another blood pressure. Has there been any change to my blood pressure with the administration of the nitro?
Blood pressure now is 140 over 80.
Okay.
Patient's respiratory rate is about 20, and he looks a little more comfortable.
Okay. So, sir, now if we were to ask about that pain again, you said that discomfort, last time you said with me it was a 7 on that scale of 1 being no pain, 10 being the worst pain ever. How are you feeling now? How would you rate that discomfort?
Probably about a 5.
About a 5. So we come down a little bit, but you're still a little uncomfortable.
Yeah.
Okay. So
But it seems to be going away.
Seems to be going away. And we reassessed the blood pressure. You said it was 140 over 80 now, so it's come down a little bit.
Yep.
So at this time, we would be able to re-administer this nitroglycerin. We could do this to a max of 3 doses, and this would be in 5-minute intervals reassessing this blood pressure. So we could go ahead and re-administer this to our patient now that our blood pressure is okay. So we'll give another 0.4 milligrams sublingual to the patient, and at this time we'll continue to transport to the hospital. Our patient is a high priority cardiac patient, and we will continue to reassess vital signs, interventions, en route to the hospital, and we will transfer care to an equal higher healthcare provider upon arrival.
Okay, thank you.